Good morning, good evening, everyone. Today we have a special guest, Dr. Pagad, and we wanted to take a look into the day in the life of our resident. So what does the residency training in the US look like? What can you expect on a daily basis? What are the benefits available to you? What are the resources you can avail of? And your prospects after residency. So it's a different kind of an interview today. But without further ado, let me just bring him in and he can introduce and then we'll ask him some questions. So welcome, Sukrut.
Thank you, Pavan. It's always a pleasure meeting you. My name is Sukrut Pagad. I am a PGY2 in internal medicine. I am a resident at University Hospital St. John's Medical Center in Westlake, Ohio.
Okay. So let's just dive into the structure of the residency. So structure of the IM residency, how many years, what are your rotations or electives by each year at a high level?
Absolutely. So each program has the electives or their schedule done very differently. There's a distinction between university-based programs and a community-based program. I come from a community-based program, so the structure or the schedule that I will be talking will be slightly different from a university-based program, but nonetheless, they're pretty much very similar. Some programs rotate students every 4 weeks or every 2 weeks. And what I mean by rotate is that they do 4 weeks in a certain department. So say it's 4 weeks in endocrine, followed by 4 weeks in hematology oncology, 4 weeks in another department, or they can do 2 weeks, 2 weeks, 2 weeks. Internal medicine is 3 years training. Family medicine is also 3 years, and surgery and so on and so forth are slightly different. Let's start first about the PGY1 or the first year. What happens in the first year. So I'll talk about my program. For the first year, we have to do 6 months of inpatient. It is mandatory that you have to do 6 months. It is spread out in a year. You do 1 month of ICU and 1 month of internal medicine. Then you get to do 4 months of electives. During the first year, you don't get to choose your electives. So what I mean by electives is anything other than ICU, emergency medicine, or inpatient are called as electives. So your endocrine gets called as electives. Your respiratory medicine gets called as elective, or your wound clinic gets called as an elective. So that's what I mean by an elective. So 4 months of electives, and you don't get to choose. The program chooses for you. Whereas if you move on to the second year, that's when it's slightly different, where we have to do 5 months of inpatient, followed by 1 month of ICU. Then you get to choose 6 months of electives. In our program, those 4 months are chosen for you. So you have to do geriatrics, endocrine, infectious disease, and rheumatology. Geriatrics means adult patients, who are 60 plus in a nursing home who need specialized care. So that gets brought into geriatric specialty. And the rest, the other 2 electives, the 2 months of electives that you can get to choose. I've chosen interventional radiology and neurology. And the third year is very similar, where you get to choose different electives, and it's very similar to the second years. When it comes to choosing electives, programs are very accommodating when you want to request an elective at an outside hospital or institution. So since our program is part of the University Hospital conglomerate, we can choose electives at different hospitals. So we have a hospital here at the Cleveland, downtown Cleveland, so where they have a lot more specialties where you can rotate through different departments. So the choices are a lot more. But always the program, they always want to keep the best interest. They always want their residents to excel and improve upon their CV.
So from what you said, programs do give you the flexibility of doing away electives at other programs and universities if you were to build your CV or maybe explore opportunities after residency.
Yes, absolutely, because they want the resident to excel, whether it be if they want to pursue fellowship, they'll ensure that the electives that you choose are at programs or at institutions where you want to match into, or if you want to do something else, if you want to be into academics or if you want to be into research, they'll ensure that that they will cater to your needs.
Okay. So now let's come to the other part, which is a question a lot of students have. How many hours per week do you work and how does this vary?
So ACGME has a standard, sort of like a law, where a resident is not to exceed more than 80 hours a week. And GME, your graduate medical education office, who's in charge of basically the residency program, they're very strict about it too. So they make sure that you do not, in a week, your work hours do not exceed 80 hours a week. Another thing to keep in mind that before, several years ago, there was 24-hour shift, but now no longer, I mean, at least for the most part, most programs don't have 24-hour shifts anymore. In an inpatient ICU emergency rotation, you get very close to 80 hours a week, but it never exceeds that. So you don't have, and then you don't do your 24-hour shifts. When you're on electives, so say your rheumatology, infectious disease, what else? Any other wound clinic, during those rotations or electives, you get to work 5 days a week and your 2 days off. So your Saturday, Sundays are off. So there, definitely, it's just 5 days from 9 a.m. to 5 p.m.
Okay. So next question, which is on everyone's mind, what are the resources you can avail of during residency? That's first question. Second, what are the benefits? How much do you earn, etc. in residency?
Good question. So when it comes to resources, I'm pretty sure the students want to know is what kind of resources does the program provide so that the resident excels on their board exams, or what are the resources that for fellowship or research. So you have access to question banks. So it can be either MixApp, it can be NEJM Plus. NEJM stands for New England Journal of Medicine, and you also have access to UpToDate and other research websites. In our program, every 3 months, you have something called a simulation lab where we have a mannequin. We get to practice cases. We get to practice procedures like intubation, centerline placement, arterial line placement. In terms of benefits, it's pretty standard all across every residency program. You are provided medical, dental, and vision insurance. At our program, you get 20 days of paid time off in a year, and they're pretty flexible. So say if you have unforeseen circumstances, the program is very flexible. They will accommodate to a certain extent, of course, but they'll make sure that your needs are met. You have access to build your financial future. They make sure they'll provide you with the resources to build your portfolio, your financial portfolio, your retirement fund, your health savings account. So all those resources where you're growing as a physician, but at the same time you're securing a financial future is also very important to a residency program. When it comes to salary, it kind of ranges from state to state. But if I were to make an estimate, I would say your first year resident makes about $55,000 a year. The second year makes about $60,000 a year, and the third year resident makes about $65,000 a year.
And when you said it varies from state to state, means the cost of living. So New York may be slightly higher salary, California may be slightly higher. Some of the other states may be around this average.
Absolutely, yes.
Okay. Now, coming to the goals of a program, right? So they hire residents, they train them. What is a program's goal from the residents or the residency program?
So the goal from a program's perspective is basically they want to create a collaborative and a constructive learning environment where the residents are taught to treat patients with wide ranges of medical conditions so that they are well prepared when they graduate. They want to develop compassionate physicians who understand the importance of shared decision-making which is grounded in evidence-based medicine, and definitely provide the necessary tools so that the residents can excel in their future, be it fellowship, academics, whether they want to be a primary care versus a hospitalist.
Okay. And now flipping it from a resident's perspective, what do most of the residents end up learning or doing as part of these 3 years?
So for residents, they want to excel each year, take the necessary skills so that when they graduate, they can be a competent, well-rounded physicians, and can slightly vary from a university-based program to a community-based program. At a university-based program, the pathology that you get to see is wide-ranging, and the opportunity to learn is a lot more. Whereas in a community-based program, you get to see your bread and butter, your common cases that you will get to see on a day-to-day basis. The other thing I'm pretty sure that most residents or most aspiring residents are keen is fellowship. Definitely there are a lot more resources available to a resident at a university-based program to pursue fellowship of their desire. And they'll have a pretty good alumni who have matched into their fellowship of choice. Whereas in a community program, it might be a little harder simply because a lot more residents pursue primary care or hospitalists. But that doesn't mean that if you go into a community-based program, your fellowship goals are doomed. It just means that you just need to work a little harder. You need to think out of the box. But at least from our program perspective, and I'm pretty sure it's a standard, they will make sure that if you voice that fellowship concern or fellowship desire, the programs, I'm pretty sure, will make a genuine effort to provide you with the necessary tools so that you can achieve your goals.
Okay. So I think this actually you answered the next question, which I was going to ask, is career post-residency. So you said fellowship, or obviously they could work in primary care or as a hospitalist, and a lot more opportunities obviously are available once you graduate.
Absolutely, yes.
Okay. Last couple of things. How does residency training different from what students may have experienced in their home country in terms of the US system?
So I would specifically not know because I've not done residency from my home country. But there are certain differences that I can think of is, EMR. Some hospitals back in home country may still be resorting to paper-based reporting. Each country has its own set of challenges when it comes to access to, So the other thing that might not be common in other residency program is social services or access to your case managers who ensure that the patients are put in the right place after they're being discharged, be it skilled nursing facility or assisted living facility or any other facility where that can ensure that the patient's well-being is taken care of. At the residency program here, you have a lot more access to other resources like phlebotomy, respiratory therapists, physical therapy, occupational therapy, which may or may not be available in a residency program in their home country. And work hours, I'm pretty sure it's a lot more hectic, a lot more demanding. If you were to do residency, say in India, where the hours are pretty long and you have to, most of them is paper-based. So it can be a little challenging when it comes to that.
Okay. Thank you. Just the last question. Now you are in residency, of course, but what do you wish you knew before starting the residency? So are there any things you wish you knew?
Absolutely. So I was always curious about what happened in a residency program, what happened on a day-to-day basis. What time did residents come into the hospital? What time did they round on their patients? What was the expectations of the residents? And what did the program expect from residents? Was I supposed to be this amazing or well-educated, I needed to know answers every single day, or were there opportunities where I could learn? It's been a long process, and I wish I had you from the very beginning so that you could have guided me through this entire process, honestly.
Well, thank you. Thank you very much, Sukrut. You're very humble and very kind. So thank you for those words. And also thank you for this great overview of our residency program. I think this will be very, very beneficial to all the aspirants trying for a US residency.
Thank you, Pawan. Thank you for having me here.
Thank you. Thanks.